Namaskar, welcome to PKS classes. Today we will study about the monoclonal antibody Omalizumab. Omalizumab is a humanized monoclonal antibody used against or used in the treatment of asthma. And before that, let us discuss the pathogenesis of asthma. Plasma cells, these are converted from the B lymphocytes, plasma cells. So plasma cells, their job is to secrete the antibody, and in presence of the allergen they will secrete antibody immunoglobulin E, which binds to specific receptors on the mast cells, basophils and dendritic cells. And in presence of the allergen, they will release inflammatory mediators which causes allergic inflammation and bronchoconstriction, and that leads to asthma. So this immunoglobulin E has a role in allergic asthma, we can say, in allergic asthma. And the anti-immunoglobulin E monoclonal antibodies can be effective in these cases, in case of allergic asthma. And the commonly used drug, commercially available drug, is Omalizumab, and the other drug under development is Ligalizumab. So the mechanism of action of Omalizumab, they specifically bind to the free immunoglobulin E released from the plasma cells and reduces the cell-bound immunoglobulin E to particularly the mast cells, and in this way they reduce the high affinity receptors for the allergens like pollen, dander, house dust mite, SDM, and reduce the release of inflammatory mediators or cytokines and other mediators from the mast cells and others, basophils, the activated monocytes, the eosinophils, epithelial cells, dendritic cells. From all these cells there will be a reduction in the release of inflammatory mediators, and inflammatory mediators from the mast cells like histamine release is inhibited, and that reduces the allergic inflammation, and they can be used to improve the allergic symptoms and complications in case of asthma, and they will inhibit the bronchoconstriction, and the bronchial inflammation is also inhibited. So Omalizumab, a humanized monoclonal antibody, binds to free immunoglobulin E in the blood, prevent binding of immunoglobulin E with immunoglobulin E receptors on mast cells and basophils and other cells, prevent the release of inflammatory mediators, reduce the allergic reaction, and in this way they can be useful in asthma. So they can be used in case of moderate to severe immunoglobulin E mediated allergic asthma, and their advantages are they can significantly reduce asthma related symptoms, they can decrease the use of corticosteroids, they can improve quality of life of the asthmatic patients, and mostly they are useful in case of severe allergic asthma which are inadequately controlled by conventional asthma medications. Besides bronchial asthma, they can also be used in case of urticaria, chronic spontaneous urticaria, and in some case of food allergy also they can be used. So this is all about the monoclonal antibody, the humanized monoclonal antibody Omalizumab. Thank you.